The Simoa technology really, and we have like 80 presentations here at ADPD, so it's a technology that relies on standard immunoassay technology as a tool for biomarker analysis. And as you know, at this meeting, the use of biomarkers in Alzheimer's and Parkinson's and all of neurodegeneration is really coming to the fore now. It's really the advancement that's allowing the development of new therapeutics that are going to impact the market. So our unique Simoa technology is an immunoassay, but we do a trick with the immunoassay. We do an immunoassay on a bead, and then we put that bead in a femtoliter well, and we can count those beads. And basically what it does is it takes a standard analog immunoassay and it digitizes it. It improves the sensitivity like 1,000-fold. So now we can measure things like neurodegeneration biomarkers that you could used to only measure in CSF, we can actually measure in your blood. And so that's really how our technology works and the advantage to our technology.
I'm also curious, what types of specific biomarkers are tested with this technology, and also how do they differ, and are there some that are more relevant than others per se?
Yeah. So it's been an interesting evolution of these biomarkers because, as I suggested before, you could only test them in CSF, but now in blood. So the first one we developed was for the tau protein, and as you know, that's an important biomarker for measuring tau tangles and accumulations that is relevant for Alzheimer's disease. So tau is one of the first biomarkers. But there's been a progression in the field over the last 10 years, and we've now expanded to a set of other biomarkers. So another important one is neurofilament light. This is kind of a generic biomarker for neurodegeneration in general. So not specific to AD, but more all kinds of neurodegeneration. And then I think what's been most impactful to the field and the drug development in particular is not just measuring total tau in the blood, but tau subspecies or isoforms that track very closely with Alzheimer's disease formation in early. So it started off with phospho-tau 181, and this kind of had a big impact in the field, a Simoa assay for that. And now, as you'll see in this meeting, p-tau 217 is really the biomarker that's most important for Alzheimer's. It tracks very closely with PET identification of Alzheimer's disease. So this p-tau 217 marker is amazing, and we had one of the first tests and the most sensitive tests available for that. But there's an expansion from there too. So there are neuroinflammation biomarkers. There's a GFAP is another one that we've developed the Simoa assay for. And then combining those biomarkers into small plexes that will give you more information about when the disease is starting and how it's progressing. And that's what we're working very aggressively on at Quanterix.